Hildegard Peplau's Interpersonal Relations Theory by Krista Peterson, RN, FMP student, Northwest Nazarene University. Hildegard Peplau was born September 1st, 1909 in Reading, Pennsylvania, to German immigrants. She was the second of 6 children, having 2 sisters and 3 brothers. Hilda witnessed the devastating flu epidemic in 1918. This greatly influenced her understanding of the impact of illness and death on families. Higher education was never discussed in her home, but Hilda was strong-willed and was motivated. She had a vision to grow beyond the normal traditional role of women. She wanted more out of life and knew nursing was one of the few choices for women in her day. In 1931, Hilda received her diploma from the Pottstown, Pennsylvania School of Nursing. She worked as an operating room nurse supervisor. A summer position at a New York City summer camp led to a recommendation for her to become a nurse at Bennington College. Here, in 1943, she received her BA in interpersonal psychology from Bennington College. While at the university, she was an intern at Maryland's Chestnut Lodge. This was a private psychiatric facility. Her time there was a transformative experience as she studied psychological issues while working with the likes of Erich Fromm, Frieda Fromm-Reichmann, and Harry Stack Sullivan. This group began to develop greater emphasis on interpersonal relationships. They believed the nurse role was therapeutic instead of just custodial. In 1943 to 1945, Hilda served in World War II in the Army Nurse Corps. She was assigned to 312th Field Station Hospital, where the American School of Military Psychiatry was located. Here, she worked with leaders in the British and American psychiatric field. After the war, she worked alongside these leaders to help reshape the mental health system in America. Through the passage of the National Mental Health Act of 1946, she helped to catalyze concerns about the mental health of soldiers during World War II and provided excitement and new treatment possibilities. It made the mental health of the American public a key federal priority. In 1947, she received her master's in psychiatric nursing from Teachers College at Columbia University. In 1953, she got her doctorate in curriculum development from Columbia University. In 1952, she published Interpersonal Relations in Nursing, a conceptual frame of reference for psychodynamic nursing. Peplau was considered a visionary. The creation of nursing theories was not a focal point in the profession at this time. Her careful and detailed insistence on interpersonal relationships as the foundational framework for nursing work quickly became the expression of nursing education in general and in psychiatric nursing in particular. Many believe that this book caused a shift in perception from the accepted practice of the nursing reform for a patient and the nurse working in a partnership for better health. Dr. Peplau's book has been translated into 9 different languages and is used throughout the world. In 1954, she got her Certificate of Psychoanalysis for Teachers from the William Alston White Institute. Peplau was certified in psychoanalysis. She developed and taught the first classes for graduate psychiatric nursing students at Teachers College. Dr. Peplau was on the faculty at Rutgers University for the College of Nursing. She developed the first graduate-level program for the preparation of clinical specialists in psychiatric nursing. She worked at Rutgers from 1954 to 1974. When she retired, she was given the honor of Professor Emeritus. Dr. Peplau received many honors and awards throughout her career. She held 11 honorary degrees. She was awarded honorary doctoral degrees from Alfred, Duke, Indiana, Ohio State, and University of Ulster in Ireland. She was an advisor to the World Health Organization and a consultant for the U.S. Surgeon General, U.S. Air Force, and National Institute of Mental Health. She helped make many policies for people with mental disease. She retired in 1974. After that, she visited Belgium and she helped develop the first graduate nursing program in Europe. In 1995, she was named to Who's Who's 50 Greatest Americans. In 1995, she was also elected Fellow of the American Academy of Nursing and Sigma Theta Tau, the National Nursing Honor Society. In 1996, the American Academy of Nursing honored Peplau as a living legend. In 1997, she received nursing's highest honor, the Christine Ryman Prize. This award is given once every 4 years to outstanding national and international nurses who contribute to healthcare. In 1998, she was inducted into the ANA Hall of Fame. She is the only nurse to hold both the executive director and then be the president of the ANA. She died March 17, 1999, peacefully in her sleep in Sherman Oaks, California, at the age of 98, ending a nursing career that spanned over 50 years. Hildegard Peplau's interpersonal relations theory emphasized the nurse-client relationship as the foundation of nursing practice. This theory explains that the purpose of nursing is to help others identify their difficulties and that nurses should apply principles of human relations to the problems that arise at all levels of experience. It gave emphasis on the give and take of the nurse-client relationship. Many saw this as revolutionary. Peplau went on to form an interpersonal model emphasizing the need for a partnership between the nurse and the client, as opposed to the client passively receiving treatment and the nurse passively acting out doctor's orders. The theory explains the purpose of nursing is to help others identify their felt difficulties and that nurses should apply principles of human relations to the problems that arise. The 4 components of person, health, nursing, and environment as they relate to Peplau's theory. The person is an organism that strives in his own way to reduce anxiety generated by needs. Health symbolizes movement of the personality and other ongoing human processes that directs the person towards creative, constructive, productive, and community living. Nursing is a significant therapeutic interpersonal process, a human relationship between an individual who is sick or in need of health services and a nurse specially educated to recognize and to respond to the need for help. The environment forces are the forces outside the organism and in the context of the socially approved way of living from which vital human social processes are derived, such as norms, customs, and beliefs. Peplau's theory is defined as an interpersonal therapeutic process that takes place when professionals, specifically nurses, engage in therapeutic relationships with people who are in need of health services, with the focus of the relationship being the client's needs, feelings, problems, and ideas. She believed that to attain this, the nurse-patient relationship must pass through 3 phases in order to be successful. In the orientation phase, the patient and the nurse first meet and must become acquainted with each other. This is the beginning of the nurse-patient relationship. The nurse clarifies roles and makes sure that any preconceptions are worked through. During this phase, the nurse gains information on what the patient wants, provides explanations for the patient, and parameters are set. Discovering and setting expectations from the relationship should be established and met early. Active listening on the part of the nurse is especially important during this phase. This is when levels of trust are developed. Looking at the diagram, you see the factors that can affect the orientation phase. During the orientation phase, it is important that the nurse recognize their own beliefs and the beliefs of their patients so that a good nurse-patient relationship can be established. The working phase, the nurse accounts for the majority of the nurse's time with the patient and when the most interactions occur. In this phase, nurses make assessments of the patient to determine how best to teach the patient and how to figure out how they can contribute to the nurse-patient relationship. During the working phase, the patient starts to see the nurse in many roles. We will discuss the roles in future slides. Nurses use therapeutic communication to provide reflective and non-judgmental feedback to patients, which will help them to clarify their thoughts. For the nurse, self-evaluation and careful observation will help them to mature professionally and will increase their understanding on how and why they relate to the individual patients in a certain way. The final phase is the termination phase, when the nurse and the patient begin to summarize the work they have accomplished and begin to move towards the closure of their relationship. The success of the termination phase is dependent on how well the patient and the nurse navigated the orientation and working phase. Phase is often thought as the discharge planning phase, as the majority of the phase occurs when the nurse is teaching the patient about symptom management and recovery at home. When the termination phase is complete, the patient is discharged and the end of the relationship occurs. The nurse adopts many roles as she moves the nurse-client-patient relationship forward. The roles are best managed if the nurse observes and assesses themselves, the patient, and the quality of relationship on a continuous basis and makes adjustments as necessary to meet the patient's needs. A stranger occurs when the patient and the nurse first meet. The nurse should offer the patient the same respect they would give any stranger and view them non-judgmentally and objectively so that their needs can be met. The nurse provides information and answers questions for the patient and becomes a health resource for them. As a teacher, the nurse educates and informs the patient to enhance their understanding of their needs. The nurse leader guides and offers direction to the patient. With cooperation and active participation, the patient will work to fulfill their needs. As a surrogate, the nurse serves as a substitute for another, such as a parent or a sibling. When the nurse works in the counselor role, she helps the patient to learn from their own experience to increase their understandings of themselves. They promote the patient's experience, leading to health for the client, such as expressions of feelings. In the technical role, the nurse provides physical care for the patient and operates equipment necessary. As a safety agent, the nurse promotes a safe environment for the patient and will protect and advocate for the patient to help prevent harm. Going back to the diagram of the interpersonal relations in nursing, you can see how the four components work together. The nurse and the client are considered the person. Peplau placed as many demands for reflection and change on the nurse as the patient. The nurse had to know themselves as well as they did their patient. Self-awareness, personal identity, and individuality were established as dominant guiding concepts for nursing. The nurse uses her roles to communicate with the patient and determine the best way to teach the patient. It's important to integrate patterns into the teaching of patients and learn the best way for them to understand the information. The environment is the context of the relationship in which the patient and nurse have created. The patient can achieve health when when they achieve self-understanding and become competent in caring for themselves.